Good afternoon and welcome to Webinar Wednesday. We're excited to have over 250 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a webinar lunch bag for answering this trivia question. Who invented the cyclotron and therefore is dubbed the father of nuclear medicine? Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to save the date for our full MD Expo, which will be taking place at the Hilton Baltimore Inner Harbor from October the 17th to the 19th. We look forward to you joining us for 3 days of learning, networking, and the latest advances in medical technology, products, and services. Registration is now open, and more details can be found at mdexposhow.com. Okay, let's see who the winner of our Webinar Wednesday lunch bag is, and it is Andrew James. Congratulations, Andrew. Of course, the correct answer is Ernest Orlando Lawrence. Webinar Wednesday would like to thank our sponsor, Universal Medical. Universal Medical has nurtured a business philosophy founded on offering comprehensive nuclear medicine equipment services at a reduced price. Universal Medical's products and services include new and reconditioned nuclear imaging systems, quality parts, excellent equipment service, training courses for healthcare technology managers, camera system moves, technical and clinical support, flexible financing options, and more. Visit uni-med.com for more information. Our presenters today are Craig Diener, Senior Product Manager at Universal Medical, and Craig Snodgrass, National Service Manager at Universal Medical. Craig, you may begin whenever you're ready.
Okay, thank you, Linda. I can get my slides to advance. There we go. Hello, everyone. Welcome to our webinar today on clinical engineering's role in patient flow and safety. As Linda mentioned, my name is Craig Diener. I'm with Universal Medical with over 22 years of experience in the nuclear medicine industry. And with me is Craig Snodgrass. Craig is also the service manager here at Universal Medical with more than 15 years in the nuclear medicine business. And along with us is actually Nick Awadu from our clinical support group here at Universal, and Mike Tolson from our parts department. So they will be presenting with us some of their expertise in their appropriate disciplines here. So today we'll be talking about, as I said, patient flow and safety. So some of the points we plan to cover will be a definition of patient flow and safety, and then also how does clinical engineering help ensure patient flow and safety. Nick Awadu will take over and talk a little bit about clinical application support and technical support. And then he'll hand it over to Craig Snodgrass, who'll share with us some tips on technical support and some tools for troubleshooting. From there, Mike Tolson will talk about, from our parts department, we'll talk about identifying the system that you're working on, as well as parts identification, repairs, and then shopping for a part. And then Craig will finish up once again with parts installation support. So let's get started. So let's define what is patient flow and safety. So patient flow represents the ability of the healthcare system to serve patients quickly and efficiently as they move through stages of care. When the system works well, patients flow like a river, meaning that each stage is completed with minimal delay. Patient safety is a discipline and responsibility that emphasizes safety in healthcare through the prevention, reduction, reporting, and analysis of medical error that often leads to adverse effects. So in other words, protecting patients from errors, injuries, accidents, and infections. When a system is down repeatedly, patient flow could be directed to other systems, other departments, etc. This can cause needless wear and tear on other systems and added stress within your department. This causes a snowball effect of possible down systems and poor patient throughput. Corrective and preventive action is the most important aspect of patient flow and minimizing downtime. When problems do occur, accurate troubleshooting and parts replacement need to be done quickly. When the system is operating efficiently and safely, it helps guarantee the well-being of the patient. It's extremely important to do a safety check, at the very least during PMs, and is needed throughout the year. Some of you who have maybe attended some of our previous webinars remember this is a point we drive home all the time, is to do your safety checks. Some of these safety check items include verifying the functionality of patient detection subsystems, such as collision pads and other sensors. Make sure e-stop circuitry works properly, and check for wear and tear on mechanical components. Be sure to follow the OEM documentation during your PMs. If you do not have the documentation, you can request it from the OEM. The technologist is your customer, so make sure you do your QC check and your simulated scans once you complete the PM and hand over to the technologist. So speaking of the technologist, we'll let Nick talk a little bit about clinical application support and a little bit on tech support. Nick?
Thanks, Craig, and thank you to everyone who's listening in today. Appreciate your attending. Well, another key contribution to assisting the clinical engineer in your roles in maintaining systems that assures that patient safety is maintained and an uninterrupted patient flow is determining when you need clinical application support to help you or technical support when that problem occurs. Now, most of the time when a problem occurs on any imaging system, the symptoms presented provide you, the clinical engineer, some direction on where to begin his or her diagnosis and the route to repairing the problem. However, sometimes it isn't clear as to what the problem really is and what might be causing the problem, especially when there is an intermittent problem. It is in these situations that you may have a need to utilize other resources to assist with finding out what is really going on. Today, I am going to focus primarily on troubleshooting from a clinical perspective. And if we talk about what we're doing today and your roles in safety and patient flow, underlying all this, and probably that's an importance of all this, the patient flow is an efficiency thing and being sure that we get the patients done. However, when you are working on those imaging systems play a key role in the diagnosis and helping those patients and those doctors come to a diagnosis and help them in the long run and help them to become, hopefully cure and become better. First of all, I really want to encourage any clinical engineer who is responsible for maintaining any imaging system or really any system that deals with the patient, that it is important to nurture a collaborative relationship with the technologists, because they are the eyes and the ears of the system. When I go in and I provide on-site clinical support or training with the technologist, I try to help and support what you're trying to do to maintain that equipment by making the technologists aware of their roles as the eyes and ears. Listen to the systems. Be there they're with the systems. They're your communication device to help you out in fixing that system. When a problem occurs, ask the technologist to describe the specific problem. When does it occur? How frequently does it occur? And get details. This can best be accomplished if you're in the room with the technologist. And during that time in the room, you together can work to try to duplicate the problem, especially when there's an intermittent problem. So you can duplicate it, you can see what's going on, and that will help you in your route on what's your next step. By working with the engineer, you also may better determine whether there is a need to consult the external clinical applications. That there might be that need arise, and or utilize technical support. If there's a problem, and let's say you are suspicious that there might be operator error that might be causing the problem. This becomes an uncomfortable situation, as you know. The technologist may be reluctant to admit that they messed up, or may not even know that they messed up and may be contributing to causing the problem. That's where, again, it goes back, and it's important to having a good relationship with those technologists. That way you can better diffuse a potential confrontational situation that might arise when you're trying to find out what you're doing and trying to fix that system. In a situation where you've got a larger department, sometimes it's valuable where you got more technologists, multiple technologists. You might want to attempt to obtain feedback and information about the problem as a group, get them all together. This can also reduce the impression that you are finger pointing at one or more of the technologists that may or may not be causing a problem or contributing to it. And as peers, they can work together and maybe help you to come together, and it kind of diffuses that situation. In the circumstances, though, other circumstances, I do suggest having clinical application support work with the technologist sometimes. That kind of communicate that as a collaborative effort that you're trying to help them out, and if they can contribute, they can make the best system repair together, and the clinical application support can work with the technologist and maybe help them to find out what's going on and also help you. When external clinical support is consulted, be sure to maintain the communications and progress between the technologist and the clinical application support to determine as quickly as possible what the next step might be. Keep engaged with the process. And I know you've got a lot of responsibilities and other systems to maintain, but try to keep engaged with the process. A lot of times the technologist is busy or they're not available to help you to point out what might be going on with the system physically there. In those situations, if you use external clinical application support, they can work with you and they can help to guide you through basic clinical simulations. If you have a clinical application support person who is good at what they do, they should be able to handhold you and guide you during the support process. They can help you to guide through the system that might help you to make that diagnosis. All of this sounds like a lengthy process. However, utilizing the clinical support can be a valuable tool for expediting the system repair process and subsequently shorten the interruption of patient flow. If clinical support is not the answer, and the system has some kind of physical problem, which is more often the case, then utilizing and moving to the next step of utilizing technical support as it's needed can be of great assistance to you. Hopefully, you have developed a relationship with a provider who is readily available to assist you when needed with technical support. And as we move on to fixing the problem and utilizing technical support, Craig Snodgrass can pick that up and he can help you out, and he's going to talk to you about that.
Thank you, Nick. Yeah, let's move over to the technical support side. Technical support is one of the most commonly used tools that we, as a service and parts provider, have. We complete multiple support calls per day. Several of those calls we receive are just that. They're just technical support requests. But we also receive several service requests, which we first handle with technical support. There are several reasons to use the technical support first. The most important is that there is always the possibility we can resolve the problem over the phone, therefore no need for on-site service. The second most important would be that if we can't resolve the problem, we may at least be able to diagnose it down to a specific part or a few parts that we can then have shipped out to be there immediately. We get calls from and provide technical support to both technologists and clinical engineers. No matter which you are, there are a few questions you will need to be able to answer before we can begin to diagnose your system's problems. A couple of those would be What manufacturer or model is your system? What are the symptoms or errors that you are experiencing? What steps, if any, have you already taken to resolve these problems? These are the three of the first things that we will need to know to be better able to assist you. Let's now look at a couple of tools we like to utilize when we are assisting you with technical support. One of the most commonly used tools today is a simple cell phone used to take a snapshot. A quick picture that can be text or emailed can be used to confirm that you are working on the same type system, the same area of a system, or even the exact part on the system. This simple step can save more time and money than any other single procedure. One of the few tools that might be better than a picture is the ability for the technical support engineer to mirror the exact system, or even better, the exact problem you are experiencing. By mirrored, we mean that the technical support engineer will have a test system in front of them that they can use to see exactly what you see. With a test system to use, troubleshooting is much easier. Having the ability to create live comparisons and walk you through step-by-step instructions as the support engineer does it themselves will lead to identifying the problem and even the correct part needed the first time through. Let's take a look at one support case example where having a system to use as a mirror was a great time saver. In this instance, our technical support team had received a call from a clinical engineer in Arkansas. This engineer had been troubleshooting an intermittent VG lock assembly. He had taken the assembly apart to inspect it. As he was putting it all back together, he noticed the inner code wheel seemed to be nowhere near the calibration point it should have been when the detector was in the required mechanical position for setting up the code wheels. Our technical support engineer, who had not seen this exact problem before, was able to go to a test system in the facility he was in and partially disassemble his rotate assembly on that system. During this process, he discovered there were two set screws on the inner code wheel hub. He noted where the two set screws were located and then questioned the on-site engineer he was assisting where his were located after his reassembly. When they discovered the positioning didn't match, the on-site engineer was able to correctly align his code wheel. From that point, he was able to finish assembly, complete a few required calibrations, and successfully test the system without further assistance. This is a great example of how mirroring can identify the corrective action and save valuable time researching for the correction. Let me now hand it over to Mike Tolson as he will take us through the parts portion of our webinar.
Thank you, Craig. Good afternoon, everyone. Glad you could all join us. Now that we've heard a little bit about the clinical and technical support side, let's get into the identification of the systems. When you reach out to the vendor for assistance and you have determined whether you're needing support or needing to order parts, the next step is to determine the exact type of system you have. And each OEM has several different models. Most models have different makes or submodels. While the gantry base is usually the same, the detectors can vary. It's extremely important to know the exact make and model to ensure you receive the correct support or the part that is needed. Typically, most systems have an ID tag located on them with the system type and serial number. If a service manual is kept with the system, this is another good way to ID the system you have. Let's use the ADAC Philips Forte, for example. The Forte Atlas is the first example of this system. With this model, much of the electronics are contained in a standalone cabinet called the Atlas. It was a short time later they released the Forte Power Pack. This is essentially the same camera with different packaging. The Power Pack, as it's termed, uses the available space in the back of the camera gantry to house all the electronics that were previously contained in the separate Atlas cabinet. Although most of the components are the same between the Atlas and the Power Pack, there are a few that are different. Most notable differences would be additional power supplies and moving the gantry PC portion into the Power Pack itself. And next came was the Forte Jetstream Ace. Externally, this Jetstream Ace system looks a lot like the previous PowerPack model, with the one major external difference being a boom-mounted touchscreen monitor. And internally, the detectors were upgraded to the next generation ACE detectors. While with this change, there were several other upgraded electronics and features. One such feature is the use of an internal router to separate the internal camera network functions from the outside department. And the final release of the system was the Forte with Jetstream AZ, which again changed the detectors. The detector card rack was replaced with the Meritage motherboard. This change led to redesigned detector bonnets on the outside. And like before, the change of detector types also required several other internal changes to power supplies and electrical components. Also, the patient table was redesigned. So as you can see from this one example, it is extremely important to know the exact make and model of your system when asking for assistance. And from there, let's move into parts identification. If a part number isn't available or you're not sure of the correct number, your preferred vendor will need a system type, description of part, or location of part on the system to try and provide a proper part ID. Most parts will have some type of identifying number or description located on them. And as you can see from the slide, the PCB or printed circuit board has a couple of labels on it, and it can be a little confusing on occasion what the actual part number is. This particular part is a 2159-5003. This is an AA3 card used in the Meritage motherboard. This number can be seen on one of the labels, but sometimes it's not so easy. There also might be a silkscreen number directly on the board as well. As this might not be the assembly part number, it can at least point your vendor in the right direction. Multiple revisions are possible as well on the same part. We have found through multiple testing, this might only affect a handful of parts. And if there is an actual revision that changes the functionality of the system, it is typically due to a system upgrade. So once again, we go back to if you have the most information possible to provide your vendor, they can direct you to the correct part number. Let's talk a little bit about subsystems. Subsystems can be broken down and sold from a full assembly as long as there is documentation on the parts breakdown. Most OEMs, they have certain full assemblies that they might not like to break down. They're trying to sell as complete assemblies, but ask your vendor. Maybe they have a parts breakdown and can piece the full assembly out. On occasion, parts can be sold with part numbers that are set up internally by your vendor. Example, there's a Siemens Ecamm Snack PC. This is sold as a complete unit by the OEM. But your vendor might have some internal components available under internal part numbers, not associated with the OEM. It doesn't hurt to ask. I've got a good example here of parts identification and revision. This is a Meritage detector motherboard. The Meritage detector motherboard is used on Philips systems, the Forte AZ, the Skylight AZ, and the BrightView. While all three of these systems use the same part number for this motherboard, and as you can see in the slide, it can have multiple labels on it. Usually one is the part number, possibly the revision and serial number. On this particular part, there's two part numbers. There's one, which is an ADAC 4x4 number, which is an older number issued by ADAC. And then the other number is the Philips 12NC number, which is the newer number. Both of these part numbers are valid, and your vendor should be able to cross it with each other. And out of the three systems using this type of board, we've found that the BrightView can have some compatibility issues and should use the same revision or higher. I want to mention repairs real quick. This is an option that can be used. It doesn't seem to get used very often. Check with your preferred vendor to see if they offer this. This is something that vendor to vendor would typically use, but this can be a helpful tool depending on the comfort level of the tech or biomed department. Your vendor might offer this option in certain circumstances. There are situations that can be done, let's say, within a few days. A part can be shipped to the vendor, and if applicable, can be repaired within a day or two and shipped back to the customer. We had a great example here of a repair option. We assisted a tech at a clinic in Texas with a CardioMD system that had damaged panels. We evaluated the problem via phone. It was determined that the tech would need to purchase replacements. Speaking with the tech a little further, he knew they had a few days between scheduled patient scans. We gave them the option of sending the panels to us for repair. We were able to evaluate the parts, and we were able to repair and repaint the panels. We returned the parts to the tech the next day, and the tech was able to remount the panels and resume appointed scanning. And the tech was very pleased with the timely manner the parts returned, and the cost savings of not having to purchase replacement panels or having a unnecessary service call. Let's move into shopping for a part. Now that we know that we do need something, tech support has given us what we need and possibly to replace to repair our system. And with the previous info we spoke about so far, you should have the info you need to contact the vendor of your choice. And know the level of the vendor you're dealing with. What are their ranges of service? Can they deal with small peripherals that are constantly being changed out, or major catastrophes such as having to replace a complete detector? Choosing the right vendor that can affordably assess small and large repairs will help save time, which will lead to reduced downtime and help maintain patient flow. Ask your preferred vendor about their QMS or quality management system. This is a good indication that policies and procedures are in place to ensure a successful supply chain management system. Pricing and availability. Typically, vendors, they base their pricing off of the OEM price. This usually will be somewhere in the area of maybe 40 to 60% off of the OEM. And availability, it can be an issue on certain parts, let's say with high failure rates. Example would be maybe a GE Infinia and GE MG. The hand controls are a high failure rate. But usually this is only with newer systems or obsolete systems. Let's mention delivery options. While FedEx and UPS are the standard, same-day delivery is an option that can be utilized. Your vendor can help you set up a next flight out option that can be picked up at the airport, or do a counter-to-counter shipment. This option isn't the most cost-effective, but in a critical situation, it may be necessary. Restock fees. Let's mention these a little bit. They can vary from vendor to vendor. They're applied to parts simply because the labor involved of retesting and repackaging the part once it's been returned. Also, when needed, a hero kit can be an option. This will typically include all the parts necessary for an intermittent problem. Let's say after speaking with tech support, the system was diagnosed with an acquisition issue, but they weren't able to, let's say, pinpoint the problem. So all of the boards associated with the acquisition side can be sent to try and diagnose the problem quicker. This can minimize downtime and shipping costs. And restock fees typically will only be charged for the parts that have been opened and used for testing. Let's move into DOAs and warranties. While vendors strive to keep their DOA rate as low as possible, your preferred vendor should have a stringent test procedure in place according to their quality management system. But as we all know, this is a possibility when dealing with refurbished and used tested parts. And your vendor should be able to get you a replacement part out for, let's say, next day delivery. And when the DOA report is returned to the vendor, they will have it tested to figure out if it's actually DOA. And here we at Universal find almost half the parts that are called DOA are actually not DOA. It can be as simple as the wrong part ordered or an installation error, which leads us into the warranties. Depending on the vendor, warranties can vary from, let's say, 30 days to 1 year. They can also be prorated warranties. There's many types of warranties out there depending on the vendor. And we at Universal, we provide a 1 year full warranty and 1 hour of tech support with our parts sales. Exchange and cores. Vendors have varying return times for core exchange parts. Typically, from what I've seen dealing with other vendors, they should be returned within 10 days. The vendor can then assess if the part is repairable, and this helps the vendor keep continued stock on their shelf. Vendors understand intermittent issues can arise, and a part might need to be kept a little longer. But communication is the key here, so you aren't receiving correspondence regarding additional billing for no core. I hope that's helps you in with your parts identification, and get a little bit of knowledge for shopping for a part. And I'm going to pass this back over to Craig Snodgrass. He's going to talk a little bit about parts installation. Thank you.
Thanks, Mike. Let's take a look at the parts installation support. Parts installation support can be very valuable for clinical engineers who might be familiar with a system, but not at a part-specific level. There are several different types of installation support that can be provided, and choosing a parts supplier that can provide the support you need will make your job more efficient and will help maintain the patient flow and safety. Having the correct documentation, such as a system service manual, is one type of support. Unfortunately, not all service manuals are detailed to a part-specific installation, so further help may be required. Tech tips developed through previous experience are a valuable backup to service manuals. A qualified, experienced parts supplier will have several tech tips from their past experiences and services. If you don't have detailed manuals, you should always if you don't have the detailed manuals, you should always ask about any available tech tips when purchasing your parts. If manuals or tech tips aren't available, or if you've already tried those and still need further assistance, it's possible that there may be some step-by-step instructions available in your parts supplier's video library. Now, not all parts suppliers have a video library, and those that do may not give you access to that library just as a parts purchaser. Some actually may charge a required separate fee for the library's use. Knowing the exact level of support a parts supplier has available to assist you with may be a question you want answered before choosing to purchase parts from a specific supplier. Video chat is also a useful tool that can be utilized just by using a smartphone. It will make the job easier for the clinical engineer and the support specialist because they will be able to see what the other sees in real time. At a minimum, your supplier should be able to provide technical support by phone. This is one of the most widely used forms of support, as it is universally accessible and easy to utilize. Earlier, when we were discussing technical support, I mentioned mirrored support and even gave an example. We have listed mirrored support again here in the parts installation portion, as we believe it is an extremely valuable tool and gives a competitive edge for the suppliers that have the ability to offer it, as not all do. Non-plug-and-play parts require a few extra steps when installing. Examples of non-plug-and-play parts would be parts that need to be configured using dip switches, parts that require software changes, or parts that require system calibrations for proper part or system functionality after installation. Most non-plug-and-play parts will require at least some sort of support unless you've previously experienced that specific parts replacement. Field service parts installation is the final form of support that I would like to mention. For clinical engineers who are not familiar with the system they are working with, are not familiar with the system they are working with, or if they would just like to learn more about the system, on-site field service parts installation may be very valuable. Not only can you learn about the part you need installed and how to install it, you can also utilize the field service engineer's time at your facility to ask questions about other parts or system functions you're not familiar with. This will also help build a relationship between the clinical engineer and the parts supplier for future technical or parts support requests. As you have just heard, there are several forms of support you can receive from your parts supplier. But again, not all parts suppliers have every type of support available. It is extremely important to select and build a partnership with a parts supplier that can provide the level of technical support you need. Utilizing any or all of the methods discussed for parts installation will further ensure your success in maintaining patient flow and safety at the lowest cost possible. Craig Diener, would you like to conclude this webinar for us?
So to summarize this, I'll just read this along with you all. So clinical engineering's role in patient flow and safety is more than just fixing the equipment. In order for the clinical engineer to play a successful role in maintaining patient flow and safety, a team effort is required. This effort should include collaboration with suppliers capable of providing technical and clinical support, timely and reliable parts, and expert service. Choosing the right partner is critical to maintaining uptime and patient safety for your facility. And I'd also like to point out, too, that the principles and practices that we pointed out today, or we presented to you today, applies to all modalities. Although we are strictly a nuclear medicine company, it does apply to everything, including X-ray, CT, MR, and anything else that you may be working on. So I hope you've gotten a little bit out of our webinar today. If you have any questions, just use the question feature on the GoToWebinar, and we'd be glad to answer anything you might have. Linda?
Great, thank you so much, Craig. Yes, we have a few questions here. The first one is, what are some of the methods used for parts ID? Most PC boards have multiple numbers, labels, etc. How do I know which number is the right one?
Okay, Linda, everybody, this is Mike Tolson in parts. Let me try to answer that one. Let's see. Parts ID, it can be a little confusing. Let's say ADAC Phillips systems, they have two part numbers, an older ADAC 4x number and a Phillips 12NC number. And Siemens is usually pretty good about labeling their parts. And that might not be the current one, but at least you have something to use when you're contacting your vendor. Look at the parts you're needing to order. Check the labels. Check for a silkscreen part number directly on the board, or a description could also be possibly silkscreened onto the board. You might not have the current part number, but this will help your vendor identify the part. Also, have your system info ready. You might have, let's say, you're working on a GE Infinia system. It needs a SIM board. This SIM board, it might have 4 or 5 part numbers on it. Actually, they do. And it's all dependent on the type of Infinia you have. So having as much information as possible is key.
I'd also mention, too, that sometimes labels tend to fall off.
They do.
And that can cause problems. Yeah. And again, as Mike pointed out, it's very important to know what system you're working on in cases like that.
Good, that sounds good. So following on from that, what are some of the methods used for parts ID?
They were in that answer there.
Yeah.
Okay, right. Okay, following on from that, what are some other examples of parts you would provide installation support through a field service engineer being on site?
Well, this is Craig in the service department. For parts installation that would require maybe a field engineer to be on site, I would say maybe like crystal replacements, or just a PMT replacement itself. Those are sometimes things that clinical engineers don't know that much about, haven't been in that deep into maybe a detector before. Other things would be some of the larger motors or gearboxes that can drive some of the systems. They may require some more calibration Or they may, maybe more of a safety factor there, that when those are removed, maybe gantries can move freely, so they have to be secured, locked down for safety reasons. Some of those also require multiple sets of hands. They're heavy. They're in awkward positions to get them in and out. So, it may be such a thing that a field engineer actually works with a clinical engineer. Then the two of them can get things in and out, some of the larger items. Those are mainly things where we have field engineers on site. Just anything that you're uncomfortable as a clinical engineer replacing, and feel you need assistance with, we're always here and happy to send a field engineer out to assist you replacing the parts that you need replaced.
Okie dokie. So after a part is purchased, what is the cost associated with part installation support?
As far as costs, it's going to depend a lot on time, and maybe where you're located at, where our field engineer is coming from. We have some standard rates we go by. We can also quote some stuff like that. Sometimes if you purchase the part from us, there may be some discounts for some labor and travel in there. If you're asking for assistance, and again, it might depend on is it just the field engineer coming in to put in that part, or is he basically there to assist the clinical engineer, because it is more of a two-man job, to do. So that would kind of be factors that would go into the cost of having a field engineer on site to take care of things.
Okay, so what factors actually determine parts pricing?
Typically, the pricing is discounted from the OEM. And availability could play a minor role in this as well. Let's say if stock counts are extremely high, it's not a high orderable part. That can affect the pricing as well, and vice versa. Stock counts are low. It's a hard part to get a hold of. Components might be hard to get a hold of to repair the part. That's going to drive the price, a little bit higher. Like any other business, availability of the components to repair, the core exchanges, the labor involved is the basis of the pricing.
Okie dokie. Now, you mentioned hero kits in your presentation. What does a hero kit typically consist of, and what about the unused parts? Are there restocking fees involved?
Yeah, we touched a little base on that. We touched base on that a little bit. Hero kits definitely can be an option. After you've spoken to tech support, they've just diagnosed the issue with your system. Let's say they can't quite pinpoint the problem. Vendors can put a hero kit together, including all the parts necessary for the pre-diagnosed issue. This can include motors, printed circuit boards, sensors. And most vendors will not charge a restock fee for the unopened parts. Some might not even charge a restock fee if, let's say, one of the parts was purchased from the hero kit. This can save valuable time and keep your shipping costs low.
Okay, we have got one more question. Why is it important if a potential vendor has a QMS or not?
Quality management system, some vendors are set up with it, some aren't. The importance of it, it should play a factor in your vendor choice. You know that the vendor, if they have a quality management system in place, they have policies for properly flowing supply chain management system. Their parts are being tested with stringent procedures. Results are being documented and saved. DOAs and warranties are monitored closely. Suppliers are held accountable for the components they provide to the vendor. And OEMs are more likely to deal with a vendor who has a quality management system in place. And this can help you knowing your vendor can go through the OEM for maybe some parts that you need. Let's say your vendor doesn't have these, but you have to go through your OEM. Your OEM is going to be more likely definitely to deal with someone that has a QMS system in place. And this is not to say that, let's say a vendor without a QMS can't provide you with quality parts and service. But you know if you're dealing with a vendor that does, there's checks and balances in place, and your vendor holds herself to a high standard.
Okie dokie, that's great. We don't seem to have any more questions, so we will wrap up now. So thank you all for a great and informative webinar, and obviously thank you again to today's sponsor, Universal Medical. Just a reminder that the post-webinar survey and certificate process is now automated, and hope that you're finding it more convenient. The survey link will be included in the follow-up email, which you will receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately. One lucky attendee will still win an Amazon gift card for completing the survey. And if you have any questions, obviously please contact us at webinar@mdpublishing.com. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. Thank you all once again, and thank you for joining us this afternoon. Enjoy the rest of your day, and we hope to see you next week.